With an aging population, injuries due to falling are not uncommon. Add dementia to that population, and upwards of 80% will experience a fall. Some will be quite debilitating mentally and physically. That will result in a huge cost to our public health system.
So cognition plays a very important role with respect to gait and balance. And it's estimated that about 60 to 80% of adults with dementia will fall per year. And research has shown that after a fall has occurred, most caregivers as well will experience increased concern, increased burden about the older adult falling again. Falls are also a huge cost to our public health system because they are the leading cause of injury related to acute care hospital admissions.
So there are many interventions that we can do for people that are cognitively intact, meaning they don't have memory or thinking problems, but there isn't a lot of high quality evidence for people that have cognitive impairment. So this is an important starting point to figure out what works to help people that have cognitive impairment to prevent them from falling.
This is a complex issue that warrants a complex but thorough investigation of the research evidence to uncover the best strategies to prevent primary prevention and secondary prevention of falls.
This research is very important because it will inform practice. The intended audiences for this research are the practitioners who want to provide evidence-informed services and intervention. And the Ontario Neurotrauma Foundation was well positioned to partner with McMaster on this research to respond to the information needs of all the practitioners in the field.
So we had an interdisciplinary team that comprised nurses, researchers, geriatricians, family and caregivers that all provided valuable insight in terms of what was important to them. So our research question was looking at the primary and secondary prevention studies for falls in community dwelling older adults living with mild to moderate cognitive impairment.
So from our search, we found 12 studies that met the criteria to be included in our review. Most of the studies were exercise interventions and included strength programs, walking, yoga, and Tai Chi. And while these studies in our review did not show an effect on reducing falls themselves, they did show an improvement in outcomes related to falls, such as an individual's fear of falls, their balance, and gait. However, there are many things to consider about these studies that make the results challenging to interpret. They were small studies with low numbers of participants, and they were very short in duration. So while we know we need to address falls and prevent them, healthcare providers such as clinicians and doctors are having a hard time finding research and evidence that indicates the best fall prevention in individuals with cognitive impairment who are still living at home or in the community.
Now that we have this important first step in the research, we need to do higher quality studies and to make sure that the research we do is meaningful for our patients and their caregivers.
The call to action is for researchers and practitioners to work together to co-design fall prevention intervention that responds to the needs of older adults with cognitive impairment living in the community and their families, of course. This issue needs to be brought forward to organizations currently working to develop a dementia strategy and work together for practice-based solutions, especially in a time when we recognize that older adults with or without cognitive impairment want to live in their homes as long as possible and in the best way possible.